Okay, starting off another episode of this amazing podcast experience with Dr. Alice Nicholl, who is a
Hey.
dentist and a home slice for me as well because she's from my neck of the woods. And
Yes.
yeah, just wanted to bring you on because I feel like we've got a lot of interesting stuff going on at the minute with
Yeah.
that dental Instagram and everything.
So
So
so fascinating. The people
that's,
love it.
yeah, that's where I wanted to dive in first, basically. What made you want to join the dental Instagram world, Alice?
Well, I originally made it because I started doing facial aesthetics stuff. So the idea was start an Instagram, post on it, and I was trying to get a bit of traction. And then coronavirus happened, so can't actually post any facial aesthetics at the minute. So I've just kind of gone on a tangent, and I post about things that aren't even related to dentistry that much. And another thing I made it for was to chat about kind of eco-friendly dental stuff because there's a lot of options out there, but I feel like a lot of people either don't put in their own research into finding them, or because they're not like right in your face in boots, they don't bother getting them. But there's a lot of stuff out there, good companies, good options. So I thought, spread the word. And obviously, I'm living in Cornwall at the minute, which is full of hippies. So, kind of the good target audience for that kind of thing. But yeah, it's kind of not your usual dental Instagram because I don't think I've actually posted a single photo
A
of
before and
teeth.
after.
No, not a single tooth on there actually at all. And I will probably keep it that way as well. So,
Really? Mm. I was actually doing a bit of my journalistic research, obviously, before you came on, and I was looking at your Instagram page, and I saw one of the highlights that you had on there was a whole bunch of comments from the public, basically about dentists returning or not, dentists being off work during
yeah,
the
we bastards.
coronavirus. Yeah. So what was the? I sensed some frustration there.
Well, yeah, because in England, at the start of the whole coronavirus thing, we were basically told to stop working. We weren't allowed to go back to work at all, not allowed to see people. But of course, the public don't know that. The public just think we're all sat at home at the minute in our second homes, in our Porsches, on full pay because we're furloughed apparently, even we're self-employed. So there were a few articles about it, and I made the mistake of going on the comments section, and all the comments just really grind my gears.
They look like
Just
Daily Mail
talking about
comments.
how Daily Mail, BBC, I think there were a few from the Telegraph as well. I also did some journalistic research and was like there replying to them all, like, you don't know what you're talking about. Blah. Yeah, just people saying stupid things. And so I decided to compile them all in a little post. And I've entitled the highlight Workout Fuel. Because I feel like if I ever need to work out and I'm not in the mood, I will read the stupid comments saying that I earn the same as a Premier League football player and saying how I have an Aston Martin and a Porsche and I get angry about it and then I do more exercise than I otherwise would.
I do think that the way the situation's been handled has not been it's been far from ideal. Basically, the dentist that was on the BBC News, he was basically just talking about how the public had been told we had been sent the correct PPE and stuff like that, and we really hadn't.
And it's the fact as well that a lot of dental practices donated their PPE to hospitals and to the urgent dental centres and to GPs and to care homes. So we were told, be good and donate your PPE. So we all donated our PPE, and then the public have been told that we've been sent this PPE that we hadn't been sent. And that was another source of the anger on the BBC comments. Was a lot of the comments were saying, dentists aren't enough; they should just buy their own PPE. But where are you going to get it from if the factory isn't like turning out enough wee masks? How are you meant to suddenly get those masks?
I think as well, a lot of practices that have given away their PPE now they can't get anymore, which is kind of ironic.
Exactly. And like I've been working in one of these urgent dental centers, and at the start we had the full like FFP3 masks, we had the disposable surgical gowns. That lasted about 2 weeks. Last week we were then told they don't have the disposable gowns anymore. So instead we have to wear like a plastic apron and then a mechanic's boiler suit that is designed for men who are like 7 feet tall, and the legs are like this much too long for me, which saves money on shoe covers because the leg just you can just tie a knot at the end of the leg. It covers your feet as well. And then another apron on top. And then this week we were told we've actually run out of FFP3 masks, so we can't do any aerosol procedures anymore. and we now just wear a single apron and surgical mask,
So you
which is
had been
basically what you're
doing,
wearing. Yeah,
yeah, you had been doing the aerosol procedures then?
if needed, like still avoided if possible. So weren't really doing that many anyway. It was still mostly extractions because most of the people who were referred in, teeth, you know, far past saving anyway. Yeah, we had the option of doing aerosols if needed, but now we're down to our last like 3 masks or something. So yeah, even the urgent dental centre can't get the PPE, so I don't know how they expect every single dental practice in England to suddenly magic it up by Monday.
Yeah, and it's funny because a lot of the equipment as well, we're being told to use like the FFP3 masks. I was never under the impression they were reusable, but maybe since you've used them, you could tell me more about that because I'm sort of thinking that I'm not going to be given that many to spare. I think I'm going to maybe have one that I've got, and that's it.
No, we were kind of ordered a few boxes, so we need a different mask for every patient. And then we were told if we get low on stock, so have to keep the same one on kind of all morning until lunchtime, and on all lunchtime to the end of the day, just put a surgical mask on top. But then it still needs to be disposed. You can't reuse it unless you've ordered like a proper ventilator, respirator thing off Amazon, which obviously no one's buying. So yeah, if they're trying to make you reuse your mask, I would just say, no, thank you.
I think as well, like there's a lot of weird mindsets about the whole situation because I'm sure you follow all those like dentistry forum pages, like the by dentists for
Yeah.
dentists and all that. Yeah. Well, back at the start of the coronavirus thing, there was a really negative view of anybody who said they didn't want to work because they didn't have the correct PPE. And realistically, those people were the ones that were probably gonna do more good, you know. Whereas people are saying, no, if you don't work because you haven't got the right mask, first of all, you're not following your like your Hippocratic oath. Do you know what I mean?
Yeah.
Whereas like you're letting people go to A&E with an abscess, so that I really didn't see that was a comparable risk at the time. And
No.
thankfully, I was proven right because a couple of days later, everybody's tune was changed, and they were talking about how, oh no, I wouldn't do aerosols, no way, you know. And then the aerosols got
But yeah,
banned.
I agree. Like the comments who were kind of slagging off people who didn't want to go to work, especially early on in the coronavirus, no one really understood the risk or how it was spread. And even now, no one really understands, what's going on with the coronavirus. So I don't think it was a mistake to kind of stop dentists working or to cut back on things because at that point, no one knew what the heck was going on at all. See, all the people who from the start were like, oh, wise up, just get back to work. Like, I'd rather not until, I know what's going on a bit.
What kind of beer you got there?
It's very, very apt for the occasion. Just a little,
Say no
little
more.
Corona. And I'm gonna be like the next Elon Musk meme in the podcast when he was like,
Oh yeah.
"You need my Corona."
He can do what he wants though, and his net worth is never really affected that badly. Um, yeah, that's just what I was saying. I was saying Elon Musk had the right idea, try and get everybody off the planet and get to Mars instead, and that'll solve all our problems. You know.
I love Elon Musk. I think he's so entertaining.
Yeah,
What a lad. Love
he's
him.
great. He's great. He's a bit nutty, you know, but
But I think it works well for him. He uses it to his advantage. It's part of his personality traits.
100%.
He suits being a wee bit
I think it plays into his kind of tech genius, like giant, like
mad
futurist.
scientist.
Yeah, yeah, absolutely. Yeah, he will be the first like man to live past 300 years. Do you know what I mean? They're gonna have his head in a jar attached to a robot.
Futurama style.
Yeah, pretty much. So yeah, you said you're working in an urgent dental center. I am too, but it sounds like we're probably on different levels of that because I've really just been doing like taking telephone calls for patients,
All
um,
right. Okay.
and seeing like one or two people if the other dentist who's there triages them in. You know, so it's
Yeah.
been really low key, and all I've had is the standard surgical mask with the standard gown and all that. But yours sounds a bit next level. So it's because you're seeing people who are like confirmed case of coronavirus
Ours
or
is class is a hot site,
hot
so
site.
we
Yeah,
could technically see people who've been confirmed, although being in Cornwall, haven't really been that many cases anyway. So as far as I'm aware, no one with coronavirus has actually come in. But yeah, because we've been deemed as a hot site and deemed that we can do aerosols if we need to, they initially just threw every single piece of PPE at us and like the walls and the rooms have plastic on them, like the computer is in a plastic bag, the mouse is in a plastic bag, the telephone is in a plastic bag, like everything's just It's like a meat factory.
Yeah. And is that replaced every time that somebody comes in?
Yeah,
Wow.
bit of a faff.
It's a lot of plastic as well going into the oceans, you know?
I know.
That's
Save the
another,
turtles.
that's another thing. It's like we always fight for one cause and then something else comes along that we deem more important and it gets backtracked. Do you know what I mean?
I know all this
Yeah.
good work I've been doing on Instagram with my friendly dentistry, and now I'm getting people in, wrapping them in cling film.
We'll be in a position to be sustainable again at some point. I think we just need to get over this first. 1st of July, we'll be back to doing some AGPs. Which, if
Apparently.
anybody who doesn't know what that means, AGP is an aerosol generating procedure, something with a drill that produces a water spray that can carry the coronavirus effectively.
Yeah, we had a patient phone up with toothache, and he said he'd had it for like 8 weeks or whatever, but he didn't want to bother the dentist with it until it was really, really bad. Because he keeps reading about these killer mists on the news, and there's the killer mist in the dentist. And I was like, it's only killer if, it's someone who has coronavirus and we've been drilling on them, and even then it's technically not killer. And he was like, no, no, the killer mists in the dentists. And I was like, okay, Stephen King, calm down.
Yeah. How has the general vibe been around Cornwall with the lockdown and everything? Like when it was at its peak and like recently, how's it been since it's relaxed a bit?
Well, we haven't had that many cases, so it hasn't been like too bad. But Cornwall in general has a very much kind of like wall themselves off from the rest of the UK vibe. Like anybody from outside Cornwall, it's like, oh my god, up country, and they're English and we're Cornish kind of thing. So especially whenever coronavirus hit, there were people calling barricade the TMR bridge, which is the bridge that goes to Plymouth that links Devon, Cornwall, really. Um, they were saying to like barricade the bridge. I saw a post on Facebook of a farmer who was saying, could we not all just take our tractors and park them on the A30, which is the main road in, and just block the A30?
It's
The
like
only
Planet
people
of the
we'll let
Apes.
through, yeah, the only people we'll let through is like ambulances and emergency services, but we'll block everybody else from coming in. So I think people down here were ready to get their pitchforks and ban
Wow.
all the outsiders. But I think they've calmed down a bit now.
That's good. I mean, I know that there's that mindset in Cornwall. I mean, I'm not overly familiar. I've only ever been once in my life, but I'm aware that they have like a language and they've wanted independence before and stuff like that. It's quite interesting.
Yeah, because I think it was the summer that we all found out where we were going for VT year, and I had applied for Truro because I fancied like change of scenery from Newcastle. And that summer, there was an article in the news that a few of Rick Stein's restaurants had been set on fire by the Cornwall Republican Army. And I was like, oh, for fuck's sake, I've had enough of this back in Belfast, and now it's in Cornwall. Just don't fuck off.
Indeed, that's one thing you got to consider, I suppose. If they've got their own little paramilitaries down there. Something that impressed me when you originally went to Cornwall, I was like, God, like you basically, if you move that far away from where you're kind of semi-established already, you almost have to start an entirely new life, and that's something that I really like. I have a bit of a desire to travel around the world and go to different places to live, but
Yeah.
I have too much of a fear of like having to start completely fresh, not knowing anybody.
Yeah.
So how did you overcome that? Because I know that you've obviously done pretty well while you've been there.
I think, to be honest, I just got a bit lucky. So obviously, I'm kind of friends with people that I work with, but my main group of friends that were down here, I met them because I was looking for houses on spareroom.com. So I looked at this house, it looked quite nice. Obviously, I wasn't over there to look at it in person. So this guy was like, oh, I'll FaceTime you, kind of show you around the house, whatever. Turns out he was from Ireland. So then there's the usual like, oh, where are you from? Oh, where are you from? And then chatting about home. And he was saying that there was a big group of Irish people down here that all meet up to play Gaelic football and go on nights out, and he could pass my number on to them. So he did, and I got added to the WhatsApp group. And then I met up with them and this whole group of people from Northern Ireland, like our age, that I briefly played a bit of Gaelic football with. So I got lucky in that respect that it was just a chance, room viewing on FaceTime, and I met a whole group of people down here.
Yeah.
And then, yeah, just people that I work with, like people in my current workplace, they're all fairly young as well, and we all get on very well. So I think it's easy enough. Like Cornwall, I'd say would be a bit more difficult because they're very kind of like community based here, and they do have that kind of view of outsiders. So I know some people sometimes struggle to kind of make friends and stuff down here and kind of hit the ground running. But yeah, I think I just got lucky to meet the right people at the right time. I think like if you move anywhere, you just have to like be sociable, maybe join a few different like they're not extracurricular activities because we're not at school anymore, but like clubs and sports things and you meet people that way. So it's not impossible. You just have to like put in the legwork the first few weeks that you move somewhere and kind of get to know the area and meet a few people.
One of the things that I found quite impressive was what you just said there was that you started playing Gaelic football, and like, I mean, I've never been a sporty person, right?
Neither
So
have I.
if I was given the option to do that, I'd probably say like, no, I'd probably put a full stop there and be like, that's not something I could do or that I would be capable of doing or integrating with at all. But um, I guess that doesn't come into the equation really. You don't really care how bad you're going to be at it, or maybe you turn out
That's
to
the
be
thing,
really
because like
good.
I had originally been added to their big WhatsApp group, and I said from the start, as soon as I was added, I was like, "Hi, my name's Alice. Like, I'm from Belfast. I'm moving to Cornwall next month. Not interested in the football at all, but happy to socialise. Yada yada." But then they slowly like roped me into coming along to training on a Monday. And in fairness, it was just a bit of like kind of kick around, five aside kind of thing. So I was pretty bad, but it didn't really matter because I would just conveniently not be in a good place to have the ball passed to me. So I'd still be on the team, but not really on the team. So that was all fine until there was one day we like started a derby kind of competition with Plymouth University had a Gaelic football team.
Right.
So there was like Cornwall Gaelic football team, St. Piran's it was called, and then the Plymouth team, and we started a little derby thing. So Plymouth came to Cornwall to play, and I just took the scores. And then we went to Plymouth to play, and it turns out one of our players couldn't come, so we were short a player. And I was only meant to be keeping the scores, and I had to play in the match. I've never been more terrified in my whole life because the other team was pretty much all boys, big scary men, and like obviously Gaelic football isn't known for being the gentlest of sports, even though this was kind of a gentle version. So anytime I had the ball, there would suddenly be like six giant men running at me, like trying to batter it out of my hands.
Hmm.
At one point, like all these guys were trying to batter the ball off of me, and I was literally screaming, like, "Oh my god, don't hurt me!" So I panicked and like kicked the ball away. And as I kicked the ball away, it happened to go through the goalposts, and I got our team a point. And everybody was like, "Oh my god, Alice, well done, amazing!" And I was like, "I don't know what's
It
happening."
was a fluke.
ah, yeah, scored a point on like my debut match. But yeah, it was kind of all downhill from there. That's kind of the highlight of my Gaelic football career.
Excellent, excellent. That's all you need, is at least to have established yourself with something a little bit more solid.
I
But
know, and we
like,
were in the local paper and everything as well. It was
wow,
like, oh, Cornwall's first Gaelic football team, and I was there in the picture.
you certainly left
So
a bit of
yeah,
an imprint on Cornwall anyway in your time there. You
yeah.
know.
So I just tell people now, oh yes, I'm in Cornwall's like Gaelic football team. Yeah, I'm there. Full forward, scored a few goals. Technically, the truth. I don't need to know the full story.
And I'm guessing the beaches have been pretty nice to live on that kind of an area as well. It's been,
Oh yeah, really nice.
yeah, because I got the impression there's a lot of like surfing and like all that kind of stuff happening there.
Yeah, 'cause most of the surfing's on kind of the north coast because obviously Cornwall's like a wee lake that comes out
Comes
and
out.
it gets quite a battering from the Atlantic. So yeah, surfing's pretty popular obviously up there. And then if the wind is going the right direction, you'll also get a bit of surf on the south coast. So I've only been like proper surfing once. I would tend to do a bit more bodyboarding because I frankly don't have the energy to like surf a little bit and then lift up the giant board and like battle the waves to get back out again. So I'd find just like a wee bodyboard that just kind of flip onto
Yeah. Does balance
less
come into that as
energy.
well?
Not bodyboarding, but surfing definitely. Um, but yeah, I'm definitely more bodyboarder than a surfer.
I've got a very, very deep and well thought out question to ask you now. I took a
Oh,
lot of time on this
fabulous.
one, right? So, when somebody comes in and asks you for a facial aesthetics procedure, how do you advise and kind of assess the motivating factors of those people? Like, you know, I guess what I'm trying to say is, if someone wants to make a change to themselves, at what
hmm
point do you say no and sort of say to them that they're crossing the line or their motivation is wrong? If you get me.
there's kind of two factors. So, like, the first factor will be, are they asking for something that's not physically possible? So, are they wanting to completely try and change their face with Botox and fillers? Because that's just not going to happen. So, part of it, like dentistry, is patient expectations. Are you expecting something that's realistic? Then the second aspect, usually you do just have like a bit more of general chit chat, and I usually give them a mirror and say, so what is it you're interested in? And then I'll watch how they talk about themselves and what they're talking about. And usually part of the consultation, you'll also ask questions as part of the medical history about, depression or anxiety, or have you ever suffered from like eating disorders, things like that. You also get a good idea of kind of their mental state. Yeah, usually I just give them a mirror and say, so like talk me through what you like, what you don't like, what you want to change, what you like but you think could be better. And then you just kind of sit back and let them talk. And then from that, you just kind of see whether it's realistic or not. Luckily, like most of the cases I get in are fairly basic, where people just want, like slightly bigger lips or whatever. I don't think I've had anybody yet that's been like, I want to look like a Kardashian, when they start off, looking like a potato. So far it's been all right.
Yeah, and I mean, another thing I wanted to touch on while we're talking about facial aesthetics was just how it's viewed in a certain way by society now. I think like the way you said about the Kardashians there, like a lot of people think that
Yeah.
like, oh, Kylie Jenner, everybody wants to be like Kylie Jenner, everybody's going out and getting like big lips and stuff, and like also Botox. There's a lot of negativity surrounding that because of basically the very very basic scientific fact that it comes from a bacterial like a bit bacteria
Yeah.
toxin. So that puts a lot of people off and makes them think that it's this kind of evil thing that's creeping into the dental world and all this.
Yeah.
But realistically, it's a lot more reversible than something like a full mouth of veneers, you know?
Yeah.
And that doesn't seem to be
Yeah.
frowned upon quite as much or taken as seriously, you know?
But you'll see lots of YouTube videos about people having that done, and all the comments are positive, saying like, "Oh my god, babe, love your teeth. Wish I could get this done. What's the name of your clinic? Oh my god, they look amazing." But someone will post a YouTube video of them who getting lip fillers to have slightly bigger lips, or having like fillers under here to get rid of their eye bags. And a lot of comments are, why would you want to do that to yourself? You were fine before. Like, this is setting a bad example for young people. So I feel like there's definitely a bit of a double standard when it comes to those
Yeah,
sort of things.
yeah, definitely. And I've seen some really drastic, like you said about people going to Turkey there and getting their teeth done like on the cheap. Um, there's definitely a bit of a culture around that, which is a bit terrifying to think that there's actually like, did you know you can get like package holidays where you
Yeah.
basically fly out and get like a dental procedure done? Like it's pretty nuts. I spoke to one lady about what her experience of it was, and she basically said like 5 surgeries with like five patients in at once, and the dentist would talk to you for like half an hour to see what you wanted, and then you get completely numbed up and get the preps done little by little, like a quarter of the mouth. Then the dentist would move to another room, do someone else's, and then they'd come back to you eventually, maybe take your impression or something like that. So there was literally a rotation of patients, like going between them, you know?
Yeah.
So that conveyor belt dentistry of full mouth of crowns is, I'm not gonna lie, it would probably be very fun to actually do. Um, but as a dentist, but it would be horrifically negligent at the same time to consider doing something
Yeah.
like that. Yeah, but then again, people that want some lip fillers, that's just gonna be absorbed. I don't really know the science behind it. I'm sure you know about it more than me, but I'm guessing it just kind of is resorbed or absorbed by the body after a
Yeah.
while.
So fillers are made out of hyaluronic acid, which is a substance that's naturally in your skin. It's what kind of holds and retains moisture in your skin. So it's just kind of like a thick version of that you inject in. So over the space of a few months, it does get dissolved naturally by your body. Equally, it's dissolvable with enzymes. So if it does go wrong or you don't like it, you can get it dissolved. So yeah.
Living in Cornwall, I mean, I know you're a big gig fan, big rock concert fan,
Yeah.
but I wouldn't be surprised that there's not much going on in Cornwall in terms of that sort of stuff.
No, not much at all, really. There's a lot of, like small local bands and like folk singers and things like that. But kind of the biggest, most exciting thing that happens down here is the Eden sessions. So at the Eden Project, every year in the summer, they'll put on like 3 or 4 nights of gigs. So last year I saw Nile Rodgers and Chic at it. This year Lionel Richie was meant to be playing, and they actually managed to get My Chemical Romance to play. Whenever I read that in the news, I was actually like, am I reading this correctly? Cornwall? My Chemical Romance? What? but obviously it's been cancelled now due to coronavirus. So back to square one. There's a good festival, the Boardmasters in August, and it gets quite big names like kind of your generic kind of indie. They'll get a few grime artists, a few good DJs and things. So they actually get quite a few big bands. I think this year Kings of Leon were playing at it. But last year it got cancelled because it's on the edge of a cliff and there was a storm, so it got cancelled. And then obviously this year cancelled due to coronavirus. So again,
Sounds like it's doomed.
Not a great year. Yeah.
I'm sort of wondering when we're going to be allowed to have huge concerts again. I think it'll be the last thing that we're able to sort of do, you know?
You know, it's kind of disappointing because like I had a lot planned for this year. I think the last people I saw, Tenacious D, that was in February, maybe March. It was at the start of the year anyway. And then I was meant to be seeing Lana Del Rey, but she cancelled due to illness. So by that point, the hotel and the flights were not refundable. So my sister had to have a weekend in Birmingham. Lovely place, Birmingham. So I had to be there for a few days.
Is that when you went to the Black Sabbath Bridge? Is that when you went there?
Yeah.
Nice.
So we ended up having a weekend in Birmingham, and obviously there's nice shops, but there's only so many shops you can look in before you get bored. So I had a fabulous weekend in Birmingham, and then was meant to be seeing Iron Maiden with Alter Bridge at Belsonic. Was meant to be seeing My Chemical Romance. Was meant to be seeing Guns N' Roses in Dublin. So they've all been scrapped. So I think the next one booked to see Ozzy Osbourne, Judas Priest in October. So that will probably be cancelled either due to coronavirus or his Parkinson's. Don't hold up much hope for that one either.
He's not doing too well, is he? I think we're fortunate we both got to see Black Sabbath a couple of times, which I think. Did you see them? Did you see them more than once? Did you see them, or was it only in Belfast?
Yeah, I saw them in Belfast, and then saw them at Download. And then I saw Ozzy Osbourne by himself at the Download in Madrid 2 years ago, which is basically like Black Sabbath anyway, because he played pretty much only Black Sabbath songs.
Really? Wow.
Yeah, I saw them, a few times, got them in there. So if I don't get to see Ozzy again, not the end of the world, just would be nice to have one gig this year.
When you saw him 2 years ago, did he seem any different to like 4 or 5 years ago? In terms of his
No, because
demeanor?
even when I saw him like 4 or 5 years ago, he was still kind of all over the place. Like whenever I saw them at Download a few years ago, he'd be like singing a song and a verse, and then he'd just lose track of what he was doing, and he'd just be going in the microphone, and the crowd would be keeping up the singing, and then he would eventually like catch back on again and rejoining the singing. So all of the times I've seen him, he hasn't quite been all there. So I don't think I'd really notice the difference, to be honest.
It's good to know. I must say, the first time I saw them was Download 2012. I think it was 2012. Yeah, it was. It'd been before university. And then when they played in the Odyssey, that was really good. But I saw them a third time. That was in Dublin in the O2 Arena. That was something else. That was next level. And that was a couple of years after. So probably around about the same sort of time you would have seen them at the second time they played Download.
Yeah.
So yeah, no, they're next level though. I love them so much. And Ozzy, I mean, I feel bad for Ozzy, you know, because
I feel like he's done quite well though, considering how many drugs and everything else he's got up to. I think he's doing pretty well to still be going the way that he is.
Yeah, 100%. Have you ever read his autobiography?
No.
It's next level. They need to make a movie about his life, you know.
He'll probably be next on the list because like they've done Motley Crue and they've done a few ones by now. So I think Ozzy Osbourne, his time will come.
Indeed. Hopefully he lives forever though. Hopefully he just continues to sort of exist. You know.
Wouldn't surprise me.
Yeah. I know the weird thing about the last album he put out is that the guy that produced it and wrote it with him is like a guy who's worked with Post Malone, because he was the guy that got the collaboration between Post Malone.
Yeah, together.
Yeah, and all these like Generation Z people are thinking that Ozzy Osbourne's like a new up and coming like singer. They don't know who he is.
I know, I saw those tweets like, who's this guy Ozzy Osbourne? Like, oh, he sounds so cool. Oh no.
Sad. Very sad. What would be the best gig you think you've been to?
Probably Slayer.
Slayer?
Just for the experience.
The Slayer gig that I arrived at about 5 minutes before they came on.
You were really stressing me out 'cause the whole time all this, well, it wasn't support acts, but like the other bands were on. You were like, oh, haven't got a ticket yet, but might come to the box office now. And I was like, oh my God, you're running out of time. And then you got there kind of just in the nick of time.
I was about to have my dinner.
I was like, what are you doing? Stop eating. You can get chips at the arena. Stop. But I was think probably Slayer because of like the hellscape background and like the flames and the pentagram flames and the screaming and the blood. It's like, you know what, this is, when I'm saying Slayer, this is exactly what I want to see. Well done, guys. Excellent production.
The stage
So I
setup
think probably
was
Slayer just for the full like bombardment of noise and like fire.
it was actually hurting my ears. Like I pride myself in being a bit of a hard rocker, but like I was at the stage where I was gonna cover my ears, because it was like just ridiculously loud and just hurting my
you could
eardrums.
feel your eardrums going like
yeah, kind of sharp going into your eardrums. Yeah, painful. But I couldn't miss that gig, and that's the reason I had to just run to the concert, because if I missed them, I would never have an opportunity to see them again, and then that would be the big four not complete: the Anthrax, Slayer, Megadeth, Metallica. Wouldn't be, But
I was the same. You need to complete the list, and also I was listening to Slayer like every day or anything, but I listened to them occasionally, and I was the same. I was like, right, if I don't get to see Slayer, have to see them just to tick it off the list and say that I have.
It's more about the spectacle, isn't it? I mean, sometimes even if you don't like listen to the music, or even if it does give you a bit of a headache, if you listen to a full album or something like that, you have to still appreciate the spectacle of it and the theater of it,
But yeah, because I think the best gigs I've been to are definitely the ones that have stuff going on. So like AC/DC in Dublin a few years ago, they were very good. They had a lot of stuff going on, cannons firing and all that kind of stuff. And Iron Maiden always put on a good show because they have a lot of set pieces and stuff flying around. So I think definitely, who else? Slipknot usually have quite a few things going on stage. So yeah, I think definitely the best gigs I've been to are the memorable ones from what's going on in the background as well as just the music.
Yeah. I mean, Slipknot's one that I didn't even realize they were playing. That's how much in my own little bubble I am at the minute. Like, they played here, I think, end of last year, and I was like,
yeah.
I found out the day after. I was like,
I tried to get tickets to see them in London, but they were sold out by 9:10. So by the time I logged on, they were all gone. So I didn't get to see them last year.
Incredible. But the best band I've probably seen live would either be that Black Sabbath gig in the O2 in Dublin, or potentially one of the Queens of the Stone Age gigs. I've seen them quite a few times, and they're not a band you can miss when they play live.
See, they're not so much my cup of tea, so I've never seen them live.
The performance is always top notch, though. Like they're next level performers.
Yeah.
I think sometimes when you see these little support bands go on, you sort of feel sorry for them. Like, you know what's coming next. Do you know what I mean?
Yeah.
Like these bands that have just been touring for years and years and years, and like you find out like they're actually like 30 years old now, the band, and they're just so tight and so like in the pocket with each other. Yeah. I feel sorry for the wee support bands.
Like ages and ages ago, I must have been like a child. We went to see Guns N' Roses, and Black Stone Cherry were the support act for Guns N' Roses. Obviously, they're now quite a big band on their own. I think there's been a few support bands I've seen that have gone on to do pretty well.
Have you seen Gojira? Have you seen Gojira play?
Seen them a few times, yeah.
Yeah, you saw them supporting Bullet for My
Valentine? Bring Me the Horizon.
Bring Me the Horizon.
Yeah, it was the same show, yeah, and Bullet for My Valentine. And I've seen them at Download once or twice as well.
Wow, yeah. That's a band I really want to see, just because their live performance is basically like better than, if not the same, exactly same sound as like the CD,
Yeah, they are very good.
I wanted to see Tool play, but they had all their like American dates were all going way into 2021. So I thought like European tour maybe end of next year, but it's not going to be at least till the end of 2022 now. I reckon,
Were they meant to be playing Download this year?
They played it last year.
Last year, yeah.
If I'd known in how long it would have taken to see them now, I probably would have just driven down to Donington and just paid the money.
Had a little day out.
Yeah, overnight. Taking a day off work or something. But that's one thing I like to say to anybody who's considering going to a concert of a band you like. Don't say to yourself like, I'm just going to see them next time, because chances are there might not be a next time.
Yeah, because that's the way I think about it. Like, if there's anybody I like who's touring, I will buy a ticket and then kind of figure out later what I'm going to do with work, where I'm going to stay, how I'm going to get there. But I'll get my ticket spot first and then kind of figure that out. later. As well, I would say don't let going by yourself put you off going to a gig either. Because like quite often, especially if you listen to stuff like Slayer, your friends aren't going to be into the same kind of music that you are, or they can't afford to go, or they can't get time off work, or they're just kind of not interested. And I think it's a real shame that a lot of people miss out on gigs because they've got no one to go with. Whereas no one cares if you're by yourself, if you're seated, you have a nice little time to yourself, sit and watch the band. If you're in the crowd, it's actually a good thing to be by yourself because you can wiggle to the front a bit more. You just act like you've lost your friends, and everybody's like, "Oh yeah, darling, go ahead." And I'm like, "Thank you, thank you, thank you." Get to the front. So I'd say like definitely don't let going by yourself put you off going to a gig. I've been to loads by myself, had a great time.
Yeah, there's been a couple that stick out in my memory that are like I was by myself, one in UK because it's just like putting a DVD in, and watching a movie by yourself, or like, you know what I mean? That's the second time I've shown my age as well. Here I've said CD when I was talking about music, and I've said
I
DVD.
still buy CDs.
Do you?
I like to have like the physical copy and look at the album artwork. So every now and again, usually payday, whenever the shops were actually open, I would go to HMV and just buy a few albums.
You
Super
see,
cool.
I'm doing the whole vinyl thing now as well, though. That's the thing.
Yeah,
Yeah, so become one of those guys, very
one of them
very
ones.
predictable, you know. So yeah, I think lockdown and all that, it's nice to sort of be completely free of anything to do because it puts a lot of pressure on your brain to kind of keep the cogs turning, and you kind
Yeah.
of it brings out your creative side a little bit, like
I say at the start, I was maybe a bit more creative, like got some craft supplies, did a bit of painting, made a little wreath for the front door, was starting to learn like Spanish again and Russian. I think it lasted about 4 weeks into lockdown, and then I was like, can't be arsed.
I used to do like sketching and stuff, but I found like I wasn't really getting into that while during the lockdown. Like I was trying to come up with new ideas for new stuff to do,
Yeah.
like music and all that. Like I haven't really played much music, so this podcast thing is one thing where I'm trying to, because I quite enjoy sitting and editing stuff, you know.
Yeah.
I realized that, and I realized like sometimes if somebody puts a video up of like a gig or whatever, I'll go through and like make a little timestamp list of the songs that they play. So it's cool. Like that plays into that's a skill that you can apply to editing podcasts together because you can put little timestamps for the conversation topics. You
Yeah, I
know?
think with the whole lockdown thing, there's been a lot of pressure on people to use the time productively and like, you must use this time to learn a language and learn an instrument because you'll never have this much free time again.
Yeah.
But you know what? Like I work every day. I'm quite enjoying just not working every day. Although still working most of the week, it's not every day of the week anymore. So I'm quite enjoying just having days where I can just lie on the beach and listen to music and like literally do fuck all.
Yeah. I think people forget that there has to be a balance of that in life as well. And
Yeah.
what you're talking about there is toxic productivity. I've heard of this.
Oh, it's got a term.
Yeah, it does have a term. And basically, it's everything's got a term these days, though. That's the
Yeah.
world we live in. But it's all about like making others feel guilty and like using it as like a high, like a perch that you're like on this next level of productivity.
Yeah,
Like
you need to come out of lockdown with a six pack and like fluent in language and be able to play the ukulele.
yeah,
No,
no excuses now
not me.
because there's nothing else to do. But
No,
I think sometimes just
not for
sitting,
me.
just being reflective is good. That's why people take career breaks.
Yeah.
A lot of false positivity as well. It's another term, and that's when people try and make you feel guilty for having a negative vibe about something. So if you say like, "God, this lockdown's really crap," like I'm not enjoying it at all, I'm feeling pretty bad about
Yeah.
it, then you should feel bad about that, you know, because
No, I love
there's so
complaining. I
many
love moaning
positive.
about things.
Yeah, me too.
Yeah, I love moaning. I love complaining. I love, slagging things off. And you cannot take that away from me by saying, oh my God, Alice, that is like toxic negativity. I'm just like, no, no, let me be grumpy.
Yeah, you got to keep it real.
Yeah.
You got to keep it real. What was the motivation for dyeing your hair? A little bit pink going on there.
Well, it was kind of all pink, but it's faded in the sun quite a lot. So, it said it'll last up to like 10 weeks, and it's been about a week and a half, and it's pretty much gone. But I wanted to dye my hair pink because at uni I dyed my hair a few different colours briefly. it was fun. And I thought, you know what, if I'm not at work at the minute, we'll dye the hair again. I'll have weeks and weeks for it to wash out. And then they announced we're back to work on Monday. And I was like,
Oh,
well, I've
okay.
just dyed my hair pink. So
Well,
wonderful.
it was a bit of a
But yeah, I just
surprise, but
fancied, yeah, a little bit of a change, a little bit of colour. All the cool girls were doing it on TikTok. So, I thought I'd join in.
of course, yeah. The thing is, though, like, if you kept that look, I really doubt anybody would say a word to you about it.
Yeah, and I don't think anybody really cares anymore about like tattoos and piercings and
No.
hair colouring and that kind of thing. But yeah, it's something I wanted to do for a while, and I think I just used, the lockdown, mental breakdown as the catalyst to do it.
Yeah. I mean, my parents, as you know, they're hairdressers, and they weren't pleased when I cut my own hair over the lockdown, and it was the first time I did it. It was tragic. Like, I got this clipper guard, and it like suckered itself. It like, I thought it would like stay away from my head quite well, but
Yeah,
it went like it pulled it dragged the hair into it, and
yeah.
it took a chunk outside my head. I had this bald spot there, like about that size for.
Well, that happened to me last summer, was it? I went to Cuba, and obviously in Cuba, everything is really old. Nothing really works very well. Everything's like half broken. And I was in this like hotel. I was drying my hair with a hairdryer, and usually I dry it upside down for the last bit to add a bit more volume. And the hairdryer sucked this part of my hair into the hairdryer. And I was standing there in the bathroom like this with a hairdryer just hanging off my head. And I was like, what do I do? And then obviously I couldn't get my hair out of it because it was too close to my eyeball to be able to see anything. I had to hack it off with a pair of nail scissors. So if you remember any photos of me from like a year ago where I suddenly had a fringe and, decided to go for
Is
a
that
fringe?
why?
Yeah, it was not by choice. It was because I lost like this half of my hair to a hairdryer. So then I had to kind of cut the other half to make it match. I've kind of kept the front bits a little bit shorter now, but yeah, it was a incident with a hairdryer that led to the fringe. It wasn't a personal life choice.
Wow.
Hmm,
Didn't know there was
very
that much of a
traumatizing.
backstory behind it. Quite an exciting one as well, all the way to Cuba.
I'm sure the people on like the tour of Cuba were confused that one day I had long hair and then the next day I was rocking up with sudden fringe. Um, so yeah, it was a bit of a disaster, really.
It's worse for you, I suppose, but like when you're me, you can just kind of shave it all off and just wait for it to
Yeah,
grow
just keep
back.
going
Yeah,
until it all matches.
I considered a mohawk at one point as well, but it's
Well, why
probably
not?
a bit too far, probably. You know, haven't quite got there yet in terms of the craziness, but it's coming.
Soon.
Yeah.
Yeah. Well,
Planning on getting home anytime soon after this lockdown kind of eases a little bit back to Northern Ireland.
I don't know because kind of flights are starting up again, but now we're kind of being told we're meant to be reopening again. So I feel a bit bad saying like, bye guys, like I'm off for 2 weeks whenever things are just reopening. And as well, I'm a bit worried about if I like fly home and then all of a sudden they decide, oh no, there's a second spike, we need to close everything down again. And then I'm like stranded in Northern Ireland and can't get back to England again. So I've kind of been talking to my sister about it and maybe going home in a couple of weeks' time, but I think I'll probably stay on the safe side and kind of leave it a bit longer until we're definitely in the clear a bit more.
The ironic thing is, because of our jobs, it's actually going to become like, this is just what I think. Like, they've eased the lockdown now, and they're going to start getting us to see people again. So
Yeah.
at that stage, from that date onwards, we're going to be more infective. Like, there's going to be a higher risk that we're carrying some kind of infection around. So
Yeah.
from that point onwards, you're going to be less likely to want to go home because you don't want to give it to anybody else. You know.
Yeah. A whole plane of people.
Whereas now we're probably the safest we've been in terms of our like
Yeah.
infection level.
Because if they hadn't have announced dentists going back to work, I probably would have been going home in the next week or two because the flights have restarted just for even a long weekend. But now that we're going back, again, yeah, I feel like I can't really go home now. It'll probably be Christmas before I'm back home again.
Yeah, that is unless there's a second spike. My worst fear at the minute is second spike starts in November and they lock us down at like November.
No, no, thank you.
If that happened, I would just be on the first boat out of there. You know,
I think I'd be the same arrived, or is it Holyhead in Wales, and I'd be out of there. Goodbye.
can you get a boat from there to Belfast?
You have to go to Dublin if you go from Holyhead, or I could drive up to Liverpool and then get a ferry from Liverpool to Belfast. But either way, it's like a full day's worth of travel. Like whenever I moved to Cornwall, We left the house at like 4 in the morning, I think, drove down to Dublin, got the ferry to Wales, and then drove the whole way down through Wales and England. And it was like nearly 10 o'clock at night by the time we actually got to Cornwall. And we didn't even stop that much. So it'd be like a full day of traveling to get home if they kind of shut everything down again.
I'm a bit of a home bird, so need to get
Mm.
back at some point. I miss my dog, which is why I'm using this mug. This is the only mug I'm
I
really
know, I did notice that.
been using. you know. So
Yeah, I just
yeah,
feel bad for my sister because she's just in the house by herself at home with
right.
like the three cats. So she's been like looking after the cats, having to look after the house, hasn't had any human contact in weeks. Like the first time she saw her friends was last week whenever they eased the restrictions back home a bit. They had like a socially distant barbecue. But apart from that, she's just been like in the house by herself for like weeks on end, and she's been FaceTiming me every evening or catch up on the day, even though every day is the same at the minute and no one is doing anything. So the conversation's just been like, so what'd you have for breakfast? Oh, that's nice. What'd you have for lunch? Oh, what are you drinking today? What wine? Oh, very nice. Do anything else? Okay, well, chat to you tomorrow. And it's just been like Groundhog Day, just repeat,
Yeah,
repeat,
there's a
repeat every day.
distinct there's a distinct lack of topics. I must admit, a small part of me was very pleased to hear about the lockdown. A small part of me was like, "Oh my God, I get to spend time doing whatever I want by myself. This is absolutely beautiful." But then obviously, I'm maybe that's like 25% of my mentality, maybe
Yeah.
30%. The rest of it is kind of like, "Oh, please let this be over."
Well, I was a bit the same because whenever the lockdown first kicked in, we had that first like little bit of a heat wave. So I was in the garden, I was making different cocktails every day, like iced coffee with Baileys, was lying on my towel in the garden with my cocktails in hand, just like this is the life. I am living the absolute dream. This is like amazing. And now I'm kind of at the point where I'm like, okay, the joke is over now, coronavirus. Like, haha, well done, ready to go back to work.
You sort of think, I think like you do need a purpose in life. Do you know what I mean? And I felt like I saw a lady a couple of days ago, like a week ago, I think it was, and it was when I was doing my day of seeing patients, and took her tooth out, and I thought,
Nice.
I've got my purpose back. I got a bit of I got a bit of an endorphin rush from that, I must say.
That's
Just
the
to
thing. Like,
think it was making a difference with something to somebody.
yeah, and like I'm quite enjoying going back into work now because yeah, you're actually like doing something productive now, and going to work is now my little social event of the week where I get to actually see people and chat to them. And my triage day in my own practice is on Fridays. So what we've been doing at the end of the working day, we've been staying an extra hour and bringing a can of cider each and just having a wee cider and work at the very end of the day, having a bit of a catch up, socialise, little bev, and then everybody goes home. And it just fills that void, makes me happy. It's very nice.
There's a lot of different like bits of rhetoric going on around it, like different like viewpoints. Like I said about some people getting angry about us reopening, some people not wanting us to reopen. Do you know what I think is the most important thing out of all this, right? Patient education is something that I've always said is like one of the most important things because
Yeah.
if a patient's well educated on dentistry, then they can make good issues and provide the right kind of consent for treatments and stuff like that. That would solve a lot of problems with litigation, and it would solve a lot of problems with people being unhappy with their treatment and stuff like that.
Yeah.
So if you had enough patient education going on about certain, like we know from a young age that we're meant to brush our teeth and we're meant to floss as well. Not everybody knows that, but most people don't know that actually. But
Yeah.
um, they should be taught as well. Like mouthwash isn't good enough on its own. You have to have
Yeah.
a brush of some kind. But then there's like little things that over the lockdown period it would have helped if people had known it already. It would have relieved the burden a little bit. Say for example, if someone gets wisdom teeth, they should be sort of educated on. Like I'm all about someone who's got an impacted wisdom tooth, and I'm like, oh, I see your wisdom tooth tilted there. Like, do you have any problem with that? Even if they say no, I think it's still
Yeah.
important to go into the detail of what could happen and how to take care of it.
Yeah.
So instead of having to then get somebody antibiotics for a wisdom tooth
Yeah.
gum flap, they know when they start to get a little bit of a pain there that if they use some chlorhexidine and like a little irrigation thing, that would sort it out. Which it really can do a lot of the time.
I think the frustrating thing is obviously like 50% of people will take your advice on board and actually start flossing, start using TP brushes, will, buy a little syringe in case their wisdom tooth flare up. And the other half of people who you could go on about it till the cows come home and they'll just stare at you blankly, come in the next time with the same issue, and you're just a bit like, I can't help you unless you help me help you. Like, come on, like, work with me here. And, especially with like kids and stuff, coming with terrible oral hygiene, I will spend ages showing them in the mirror, going over it in detail, like disclosing tablets, all kind of things, and say, okay, so talk back to me. What do you have to do? They'll repeat it back to me. I'll be like, wonderful, I've made a difference in this child's life. And then 3 months down the line, they come back in, and I'm like, why? Why have you done this again? Why? Please brush your teeth.
I think a lot of the time as well, when kids are getting problems, especially kids, the parents just are sick of hearing it, so they'll just make it sound a whole lot worse than it actually is sometimes. Um, yeah.
My favorite thing to do is sometimes if they've got a lot of plaque on their teeth and they've obviously eaten food that's stained it a bit, so it's either a bit green or a bit orange from their pasta, I'll be like, the bacteria living in your mouth, they're orange bacteria, and you have so many of them on your teeth, you can see that orange color. And I'll scrape it off their teeth and I'll say to them, okay, so would you lick this off my probe? And they go, ew, disgusting. And I'm like, what do you mean disgusting? It's already in your mouth. And then they have like a little moment of realization and they're like, oh my God, she's right. She's right.
The one that I always give as an example is like, oh, I really want to get my teeth sorted, mate. Like, this has to change. Like, I'm fed up, And you look in, it's just like black, decay, like black and green colored stumps. Like, you can't determine which tooth was which because the gaps are all different, and like there's ones
gone.
that are like, yeah, yeah. I think there's just some people that it's just very hard to get through to. But those people need a bit of a breakthrough. I think sometimes it is a bit of a lost cause for the dentist to actually, but
yeah,
maybe that would be the straw that broke the camel's back, and then they start taking better care of it at that point.
yeah, I think just you are just kind of wasting your time going over it again. They need to either have something like that happens to them where they think enough is enough, or I know I had one lady who came to get her teeth sorted because her granddaughter, the way kids are, had started saying like nasty things about her teeth, and like Granny's teeth are yellow, Granny's teeth they're like black, and that really affected her to the point where she came in. She was like, right, enough is enough. Want to get this sorted. So I think sometimes
kids tell the truth.
Need a bit of they need a bit of a push from an external source to finally start taking things on board.
Yeah, or somebody that they're emotionally invested in, or something that matters to them. You know what I mean? Sad but true. We'll get there. We'll get there.
Hopefully. But I think part of the issue is people don't make that connection that this is like a body part that is decaying in your mouth due to hygiene and diet, and it is preventable. Like gum disease and tooth decay are the number one preventable disease in the world. But I think it's become so normalized, like, oh yeah, just going to go to the dentist and get filling, or bad teeth run in my family, like all my family members have had to have teeth taken out. It's become normalized in their heads. They think, oh, it's just par for the course. Like, oh, I need another filling, or like,
it doesn't have to
oh,
be
I need
this
to
way.
out, like, big deal. Whereas I think, education is very important, and like trying to get that message out there that it is completely preventable. Like, I've never had a filling or anything done. It is possible. But I think it's just kind of teaching people that it's not a normal thing, and it's not a normal thing that your 5-year-old child has to go to hospital and have teeth taken out. Like, it's something that is preventable, shouldn't be happening, and we need to try and like somehow, I don't know how, but somehow I can drill that into people.
I mean, I know a lot of dentists take the approach where they don't even treat a tooth if someone's got loads of caries. Like, if they've got loads of decay everywhere, they'll just be like, no, I'm not touching any of that until you start to show me that you're taking better care of your own teeth. Would you take that approach, or would you rather just get it all treated?
No, I think that just because someone's not taking good care of their teeth, it doesn't give you a license to leave them in a condition that could cause them pain or cause dental abscesses that can, potentially be life-threatening. If I've got a patient like that, I will do a scale to kind of clean things up, even if it is just for the one day until, they go home and don't brush their teeth again. I will do caries removal, but I'll probably fill it with like GIC instead of wasting my time with like fancy restorations and crowns and all kinds of things. So, I'll give them a good clean, do GIC, pop on a load of fluoride varnish, prescribe them Durafat, and then go over oral hygiene a lot in the hope that they take it on board. if I have to keep coming back for more fillings and more extractions, at least I can say that I've done everything that I can to prevent that, and it's kind of on them that they keep coming back with the same issues. But yeah, I don't think I'd be a very good dentist if I came in to work and someone had loads of problems and I was just like, oh, not my problem. Like, come back to me when you've fixed the issue. Even if it's not like a permanent solution I can offer, if I can like do something, I'll do something.
I think like what you said there about stopping the pain from happening is probably the main thing, really.
I think some dentists, I can see why they have that mindset, but I don't want to be that dentist that the patient goes home and goes, oh, I told my dentist I've got lots of holes in my teeth and she didn't do anything about it. Like, I don't want them going spreading that gossip about me, like, oh, I'm a shit dentist who knows that they've got issues and didn't bother doing anything. Like, I'd rather do something and then that issue's kind of avoided.
Do you want to tell people where they can follow you on Instagram?
It's Dr.Nicholl, so Dr.Nicholl. And yeah, that's my little dental Instagram. If you want to follow a dental Instagram that doesn't actually post any dentistry, then that is your place to go. So yeah, follow me on that if you're at all interested. Most of the time, it's just me kind of ranting into the void. But hey ho, if you like the sound of it, you can follow it.
Thanks so much, Alice.
Yeah, no problem. Very enjoyable.
If you've managed to watch this far into the episode, then thanks so much as well to you, and I will see you next time.